Obitur Solutions, a leader in secure document printing and a privileged partner in digital transformation, is proud to bring its official support to the group of SIDS Leaders Conference.
Excellencies, ministers, honoured officials from the international agencies, ladies and gentlemen, a very warm welcome to this second meeting of the Group of Small Island Developing States Leaders, otherwise known as SIDS. My name is Juliet Foster, and I'll be guiding you through 90 minutes of lively and what I'm sure will be thought-provoking debate on the theme of pandemics, prevention and preparedness. Now, this event builds on the success of the first SIDS leaders meeting, which took place in early May. And at that time, we explored the impact of the Cotonou Trade Agreement on small islands. Now, as the international community begins to build a future beyond COVID-19, small island developing states are demanding a voice in contributing to and indeed benefiting from the process. But it has to start with addressing the distribution of vaccines to the largely vulnerable community of some 38 sovereign small islands across the globe. Now, to put this in perspective, a recent policy brief by the United Nations Department of Economic and Social Affairs reported that the number of COVID-19 related deaths per 100,000 people was actually higher in SIDS compared to other developing country groups and regions, and I'm including within that LDCs and LLDCs. So from the UN to the World Bank, from the EU to the various NGOs, the pandemic is seen as having not only magnified the vulnerabilities of SIDS, but has also faced them with stark choices that have the potential to cause long-term economic and social damage. A 2020 UNCTAD report found that SIDS experienced a GDP fall of 9% compared to a 3.3% decline in other developing countries. At the same time, only 6% of COVID-19 related spending for developing countries was spent on small island developing states. That's an increase of 2% from August 2020. Well, the result of this is that COVID-19 is stretching national budgets to breaking point, with SIDS having to choose between paying off external debts or preparing for another pandemic or even the next tropical storm. Well, as SIDS struggle to repair their public balance sheet, extra funds will be required to finance the immediate health response to lead the way to economic recovery once the pandemic itself is brought under control. It's fair to say that this is a truly massive task for small island developing states who rely on commodity exports, tourism, and indeed other services. So today we're going to explore whether the international community and transnational organisations recognise the enormity of the challenge and whether we're doing enough to help. And what about the vaccine programme? COVAX, the body responsible for making vaccines globally available, has approved another $775 million to fund the delivery of the COVID-19 jab to lower income countries over the next 2 years. Does it go far enough? And how much of a difference will it make realistically? Well, to debate these issues, I'm delighted to say that we have a distinguished panel of experts. They each have an allocated amount of time to give a speech outlining their position, after which they will be asked further questions. And I'd like to stress at that time that it is important for all of you to stick to the amount of time that you have been given, as there is quite a lot of ground that we have to cover in the time available. Also as well, if you could mute your microphones when you're not using them, that would also be very helpful. Now, before we hear those speeches, I would like to call to the floor the co-founder of this SIDS group, His Excellency David Doyle. He is the ambassador of St. Kitts and Nevis, and he's going to share his opening thoughts and indeed some warm words of welcome. So, Excellency, the floor is now yours.
Thank you, Juliet. Excellencies, distinguished guests, welcome to this Global SIDS Leaders event devoted to pandemics and its implications for small island developing states. Now, this is the second such event which brings together leading experts from the European Commission, the UN family of organizations, multilateral and bilateral organizations, along with senior ministers from the small islands to debate critical strategic issues about the future stability of this particular community. SIDS makes up something like 38 sovereign states scattered across the globe, from the Caribbean to the Pacific, from the Atlantic Ocean to the Indian Ocean, representing some 20% of the UN membership. It was with a view to giving these particular small islands a more assertive voice at transnational level that the GSL was initiated by the governments of St. Kitts and Nevis, the Solomon Islands, Dominican Republic, and the Seychelles earlier this year to fulfill this ambition. The GSL platform enables these small islands to articulate their strategic vision at transnational level on strategic issues such as the one we're going to discuss today, a damaging pandemic inflicting huge economic hardship on islands with limited institutional capacity to respond. In collaboration with my co-founding partner, Ambassador Jean-Paul Catteron from the Solomon Islands, we will be rolling out future GSL thematic debates in the next couple of months on social, economic, and financial policy areas affecting SIDS. But let me leave you with one simple thought. Despite representing 20% of the UN membership, the remoteness of these small island developing states, their size, their limited institutional capacity, means that sometimes they struggle to get their voice heard at bilateral and multilateral fora. So ultimately, the GSL initiative seeks to inscribe SIDS' strengths, weaknesses, opportunities, and threats at the heart of the global development agenda, and allows SIDS to become an integral part of the solutions to the big issues that we are trying to tackle globally at the moment, whether it be climate change or combating this pandemic. Allow me in conclusion to thank the sponsors of today's event, Aubetoir Fiduciaire, and its president, Nicholas Koudros. Enjoy the event. Thank you.
Ambassador Doyle, thank you so much for that. Let me now hand the floor to John Ryan, who is the Director for Public Health, Directorate General for Health and Food Safety at the European Commission. Mr. Ryan was previously a Commission representative on the board of the European Centre for Disease Prevention and Control. So, Mr. Ryan, the floor is now yours, and you have 5 minutes.
Thank you very much. Thank you very much for organising and inviting me. So, the first point I wanted to make is that, of course, the pandemic has shown the interface between health and many other policies. The minister spoke earlier on and spoke about the impact on society as a whole, on the economy, on tourism, on travel. And this is something we've also seen in the European Union, where there has been a recognition that health is really underpinning many of these other rights and policies that we have. We have mobilized all of the instruments available to us in the European Union in order to support the response to the pandemic, particularly by trying to coordinate the 27 member states, by making the interface between our member states and the international community, by securing medical supplies and vaccines, and of course by working to try and organize the reopening of society, keeping the economy safe, keeping our population safe. The EU vaccine strategy is perhaps a good example of the power of working together. Within a few months, the 27 member states of the European Union procured 2.3 billion doses of vaccine. And in addition to the original procurement, we have now managed to purchase an additional 2 billion doses on top of the 2.3 that we originally had. And of course, we're using these vaccines, which were developed in a very record time, to also contribute to the international efforts. On the EU level, we have succeeded in vaccinating 60% of our population with at least one dose and 40% with the second dose. So these numbers are growing on a daily basis. And as our colleague from WHO said, we've got to be careful about the variants of the virus, which are transmitting in different places around the world, including in Europe. So the sequencing efforts to increase the knowledge of where these new variants are appearing is very important, and also checking, of course, to see what effect they have on vaccine efficacy. We are trying to learn lessons at the moment, and these will be lessons which we will learn in terms of the internal EU legislation on cross-border health threats, but also the financial investments which we need to reinforce our health systems. And I would say it's important that we develop global solidarity and cooperation in addition to COVAX, to which we're contributing in a very substantial way. We're also hoping that the discussions on the pandemic treaty, which are going on at the moment in the context of WHO, and also the strengthening of WHO, will also be ingredients in the follow-up to this pandemic. So the European Union, I think, is fully engaged not only for its own protection, but also to try and show solidarity and support to other parts of the world, including the group of small island developing states. Thank you very much.
Thank you so much for that presentation. I know that you have to leave us, but we thank you for the time that you were able to spend with us outlining the vision going forward. All I can say now is have a wonderful afternoon, what remains of it, and I hope to see you again very, very soon. And to all of you, please stay safe.
Overture Solutions, leader in secure document printing and a privileged partner in digital transformation, was proud to bring its official support to the group of SIDS Leaders Conference.